Okay. Hello, everybody. Welcome back. Next up on our speakers, we have Ashley Henderson with Select Physical Therapy, and she's here to talk to us about the pelvic floor. We're so excited to have you, Ashley, because the pelvic floor is not something that I knew a lot about before I started having kids. And that can be a pretty big problem. It's a very important part of childbirth. So we're so happy to have you. If you could just tell us a little bit about you and how you got into pelvic floor therapy.
Sure. So, like she said, my name is Ashley. I am a physical therapist and I have specialized in treating the pelvic floor. I work at Select Physical Therapy off of Airport Boulevard. So, I too knew nothing about the pelvic floor, even as a physical therapy student. And it wasn't until we actually had a guest speaker who was a pelvic floor physical therapist come and speak to our class about pelvic floor therapy that I realized I might be experiencing some issues that need to be treated. So, little backstory, I had my first child before going into PT school and had a forceps delivery. So, there was a little bit of trauma there. And I was experiencing some pretty common symptoms. Um, and I had just been told by my OB, oh, that's normal. You had a big baby. We used forceps. It's just, is what it is. So here I am, 25 years old, thinking I'm going to pee in my pants forever when I go to the gym. And about 10 months in, we had this pelvic floor therapist come and speak, and she's talking about all these things. And I'm thinking, I've got that. I've got that. I've got that. And I spoke to her after class, and she recommended that I see a pelvic floor therapist. And I went, and I'm telling you, my world totally changed. They fixed me right up. Uh, and I just, within a couple of sessions, had no more of my issues. And so from that point on in PT school, I knew this is what I want to do. This is the type of people I want to treat. There needs to be so much more education out there, and we need to, just spread the word that, hey, these are not normal problems, and you do not have to wear a pad when you go to the gym.
And there's a solution. Like, that's the best
Yes,
part, is that like
yes.
there's therapy. Yeah.
And, I had been told, even by, my friends at the gym, my mom, my doctor, well, you had a big baby. That's normal. That's just part of being a mom. I'm sure many of you have heard phrases like that in the past. And once I realized that that's not true, that these issues are, yes, very common, but they're not normal and there's treatment, my whole world changed. So I just kind of targeted all my studies and everything in school towards becoming a pelvic floor therapist. And here I am treating the type of women that I want to treat.
That's wonderful. I'll get into a few specific questions now. So after having kids, how soon can you start exercising or working out?
So the recommendation is always that you wait until your 6-week postpartum checkup with your OB. Now that is for return to the gym. My recommendation to my patients is that you can start with gentle pelvic floor contractions and gentle abdominal bracing or contractions. So drawing in your belly button towards your spine, like that transverse abdominis muscle, which sits low in the abdomen. You can start activating those muscles as soon as the very next day. That's really just to help bring your awareness back to those muscles, because during pregnancy, they get super stretched out and we kind of disassociate a little bit from those muscles. So it's always good just to kind of do a gentle contraction. And that typically is squeezing the muscles that you would squeeze if you were trying to stop the flow of urine. So I have a little model. So I'll show you guys what the pelvic floor is and what I'm talking about. So let me just pull it up here. Okay, so I'll do my best to show you guys. So this is the pelvis, okay? So if you look from the bottom up, this is what you would see. So I'm trying to show it towards the camera. Okay, so here's your vagina and your rectum. All of this red stuff, that's muscle. And if you look from the inside, you can see a bunch of red kind of textures there as well. That's all your pelvic floor. So it's not just one muscle, It's a group of small muscles that work together. And so they serve a couple of different roles. One of the jobs of the pelvic floor, though, is to squeeze when we're trying to prevent leakage with urine or fecal matter, and then to relax when we want to expel those things. So when I say squeeze, like you're trying to stop the flow of urine, that's what I'm speaking of. And these are the muscles that we're kind of talking about. And these are the muscles that tend to get stretched, as you can imagine, because your bladder and uterus sit right on top during pregnancy. So back to the question about going to the gym. You can start with gentle abdominal and pelvic floor contractions as soon as you feel ready. You can return to the gym about 6 weeks postpartum once you've been checked by the OB. And then I always say it's best to only return to what you were lifting during pregnancy. At 12 weeks, you can start to progress on that. So if you want to increase your weights, you can do that then. I always say wait till 12 weeks if you want to return to like a group fitness class or personal training or heavy weightlifting. It's best to wait till 3 months postpartum.
Okay. I think you covered this already, but just are there any like other lifting restrictions or anything like that?
So the only thing that I would say on lifting restrictions is to be aware of your body mechanics. So what I mean by that is how you're holding your baby, how you're lifting your baby. So it's best in those first 6 weeks that you only lift how heavy your baby would be in their infant carrier, so their car seat. You want to make sure when you're picking your baby up out of the crib that you go to their level as best you can to bring your chest down to their level and bring the baby up close to your chest. When you're breastfeeding, if that's the route you've chosen, you want to make sure you bring the baby up to you. So having some support pillows is best. You don't want to hunch over to your baby. Bring the baby's mouth to you.
Okay. Getting into like some of the issues that, I mean, you mentioned a couple before that, we're kind of told, oh, that's normal. That's part of having kids. So is leaking urine, is that a normal thing after having a baby?
No, it is not. So
Or during, I mean, that can happen during pregnancy too.
yeah, so during pregnancy and after pregnancy, urinary leakage is not normal, but is very common. And so I like to use that phrase to reassure you that yes, many, many, many women experience some form of urinary leakage. That's typically when it's associated with pregnancy, that's going to be stress, urinary incontinence. And what that means is physical stress on the bladder. So heaviness, pressure, typically either due to the baby sitting on the bladder or after delivery with a cough, a sneeze, jumping, returning to activity, and those sorts of activities. And no, it is not normal, can be very common, but it is treatable.
Okay. You mentioned sneezing. I think the technical term is peasing. That's what.
Yes. So the squeezing your legs together is a classic mom move, but again, not
Typical.
normal for a healthy individual. So it's definitely something that can be treated.
Okay. What about intercourse? Should that be painful after having kids? I mean, obviously, in the first few weeks, probably not going to be on the agenda anyways, but should that be painful? And at what point is that safe to start engaging?
So again, typically that's somewhere between that 4 and 8 week mark that your OB will give you clearance to return to intercourse. And again, that's only when you feel ready. I think it's important to note that having low libido or not feeling the desire to be intimate with your husband or partner is completely normal. It's just due to hormones, and it can be present as long as you are breastfeeding because those hormones still haven't leveled out. So don't be alarmed by that. It might be a conversation worth having with your partner just so they are aware, like, hey, this might happen and this can be normal. But as far as pain with penetration, again, I'm going to use this phrase a lot. No, it's not normal. It can be very common, but it's not normal. And it can be common because of a lot of issues, but really, your hormones are changing. A lot of times there are some issues with lubrication. So I tell everybody it's good to have a good water-based lubricant. When you do return to intercourse, it's going to make things easier. There's also some positions that make it a little bit less painful. So, one of those, I'll give you guys a couple of examples. So, typically, you want to be in a position that allows the pelvic floor to relax. And so, those positions are going to be maybe laying on your stomach with pillows under your lap. That's going to be a good position to try if you're having pain with intercourse. Being side lying, so laying on your side, kind of in that fetal position, that's another good option. Or being like standing at the foot of your bed with your tummy supported on the bed. That's another good position to try if you're having pain. But the best thing is to go get checked by a pelvic floor therapist to see if there's something that they can do to help reduce some of that pain.
Okay. And what about just pressure and heaviness? Is that something that's, again, like perhaps common but not normal?
Yes. So that one would be a little bit less common, although it does happen. And it's typically associated with something that's called pelvic organ prolapse. And what that means, part of the job of the pelvic floor is to hold all of our abdominal cavities in their place. And so, what can happen with pregnancy because there's so much pressure and weight is the bladder and or the uterus can start to drop a little bit, and it can actually drop into the vaginal canal, and that would be a pelvic organ prolapse. You can also have a prolapse of your vagina as well as your rectum, although those are less common with pregnancy or due to pregnancy. So having heaviness and pressure in your vagina could be a prolapse and would warrant to get checked just to be sure, because they do progress if not treated and could ultimately need surgery. So it is something that you would want to be checked if you're experiencing those symptoms, especially if you're still experiencing them 3 to 6 months postpartum.
Okay. If someone is having these issues, when should they seek therapy? And kind of a follow-up to that is it worth it to seek therapy even before these issues arise?
So I always recommend a little bit of prehab, is what I call it. So if you are trying to get pregnant or you're planning a pregnancy in the near future and you want to be kind of in tip-top shape, you can always seek the help of a pelvic floor therapist. If you are pregnant, you can seek the help of a pelvic floor therapist, especially if you are experiencing some symptoms such as urinary incontinence already. But as far as postpartum care goes, you can start seeing a pelvic floor therapist as soon as you feel ready. Most pelvic floor therapists will not do any sort of internal check or examination without having clearance from your OB, and that typically happens at the 6 week postpartum check. So most patients wait until 6 weeks, but you can start as soon as you feel ready. Typically, if you're in that new mom phase, you're not ready to leave the house that early, and that's fine. Um, but I would say if you're still experiencing symptoms 3 months postpartum, then it's time to see somebody. And those symptoms would be kind of like what we reviewed, any kind of urine incontinence or fecal incontinence that can happen if you had a more severe perineal tear, like a grade 4 tear. If you're having any pain with intercourse or using a tampon, those sorts of things, as well as any heaviness or pressure in the vagina, I would recommend that you go and find a local pelvic floor therapist who can at least do an evaluation and tell you if it warrants therapy.
Okay. And what exactly would therapy entail? Is this something, how often are you going to have to come? How long does it typically last? Like, I know it'll depend on the severity of the issues, but
So, pelvic floor therapy is no different than physical therapy. So I tell my patients, we are evaluating the muscles, we're determining if there's any dysfunction in those muscles, and then we set a plan of care, and that looks different for everybody. The only thing that makes pelvic floor therapy different from your just traditional outpatient patient physical therapy is that the muscles are all internal. And so that will require an internal vaginal exam. Now, that doesn't mean you have to have one. Many pelvic floor therapists are skilled and do external exams and get a good picture of what's going on internally. Some patients just choose not to do an internal, and that's fine. But for the most part, we would do an internal pelvic floor exam, and that is going in through the vagina. It would be a little bit more thorough than what you would experience maybe at an OB visit, but it's just a vaginal exam, and we would determine what the issues are and how we would treat it. Now, as far as how many visits, that all depends on what we would find. Typically, though, it's somewhere between 1 to 2 times a week. Either you're working on relaxing some tight muscles or you're working on strengthening some really weak muscles or anything in between that. So that can really vary on the individual.
Okay. If someone is wanting to seek pelvic floor therapy, how can they get an appointment?
So in Florida, we have direct access, which is great. So that means you can call up any physical therapist anytime and set up an appointment. However, you will need a referral from a doctor if your treatment is going to go longer than 30 days. And I will say most pelvic therapy is going to go much longer than 30 days. You have to think it took 9 months to grow a child and birth a child. It's going to take a little longer than 30 days of treatment to correct any dysfunctions that may have occurred. But you can at least get that evaluation done and then call your doctor. And most providers, especially in our area here, are really good about sending over those referrals to us. So I'm located in Pensacola. I'm off of Airport Boulevard. Our office number is 850-477-6966. You can always give us a call. We're with Select Physical Therapy and get an appointment. We do have a couple of other locations. So if Pensacola is not a convenient location, there are several other locations that we do have pelvic floor therapy at. And if you call that number, they can get you set up at those locations as well. Yeah, does that answer your question? I kind of went off on a tangent there.
No, that was perfect. I wanted people to be able to reach you if they needed it.
Yeah.
Yeah, I think that wraps it up. Ashley, thank you so much for being with us and for sharing all of this wisdom. I hope that, again, like you said, I hope we can keep spreading the word because
Yeah.
it really helped me, and I know that a lot of other women I know it really helped to go see somebody. And so, thank you so much.
Thank you so much for having me. And I hope, if nothing else, this educated some women on what pelvic floor therapy is and what we can do to help them.
Okay, thank you.
Thank you.